I grew up in this community. Marinette's a city of about 10, 11,000. It was the kind of place where you didn't have to lock your doors. The mom down the street was just as likely to take care of you as your own mom. But here I was forced the reality that heroin was in my community, and worse, it was actually in my home. For her, the addiction started with OxyContin, a prescribed pain medication. We actually had a doctor selling prescriptions on the street, and Cassie was one of the ones who became addicted. And once you're addicted, you don't care where you get that fix. Heroin was the next step for her and for many others. A lot of people that are struggling with addiction oftentimes are using drugs to be able to cover up for other pains they might have in their life. Her mom and I did divorce when she was about 3. She also had a teen pregnancy about 16. We also found out later that she was actually sexually assaulted from about the ages of 8 to 12. So about 17, we learned that she was truant, because she was once a 4.0 student, and now looking like she may not graduate from high school. But it really was only the beginning of the challenges that we faced over the next several years once she admitted that she had an addiction. Her mom was actually going home to shut the windows. Cassie was purple, laying on the bathroom floor. She called me, and I raced over and tried to help her breathe before the paramedics arrived, thinking that she might be gone. The paramedics showed up first. At that point in time, the paramedics could carry a drug called Narcan or naloxone, and that drug actually brought Cassie back from the overdose. And so she ended up completing a full 3-year sentence for possession of heroin and paraphernalia. I think the average person, perhaps myself, prior to Cassie's addiction would have said, oh, that can never happen to me, that can never happen to my family. But when you consider that it starts with something as innocent as getting your wisdom teeth pulled and the doctor prescribes Vicodin or hydrocodone and you become addicted, that's where it starts in about 90% of the cases is legal prescription drugs. So we need more people to be aware that yes, it can happen to them. They need to, talk to their kids about the realities and just be aware of where your kids are going. Be aware of who their friends are, because, Cassie made decisions on her own that affected her, but who she was friends with and her influences outside of her family were a big factor in those choices she made. So with the younger kids, we've always been very careful about making sure that we call the moms, the dads, if there's a sleepover, to try and find out more about, what kind of environment they're going into instead of, just kind of trusting. We were complete novices dealing with addiction. One of the things I guess I've learned is she may be doing well today, but we know tomorrow could be different, because addiction is not something you ever recover from. You might be in recovery, but you're never recovered, and that's going to be something she faces the rest of her life, and us, as long as we can be there to support her.
Brought to you by the WCA Group Health Trust.